What is Transform Autoimmune Disease Naturally? What is the Transform Protocol? Who am I? If you haven't joined our Facebook group, please click the link that's being provided in the comment section right now to join our Facebook group, Transform Autoimmune Disease Naturally, where we literally have hundreds of bonus trainings like this and interviews and trainings all around autoimmunity and any symptom, to be honest. You don't even have to have autoimmune disease to be learning a shit ton here, period.
I am Joseph, aka Dude. It's good to be here with Dr. Yu. I work in the industry, and the reason why I've actually was so, excited to get into this is because there's not really much else out there like this, as far as I'm concerned. So what exactly is Transform Autoimmune Disease Naturally program? What is it?
It actually is an online educational and coaching program for people to actually learn from an expert how to use their own data to actually identify the root causes that's triggering their autoimmunity to end it. So it is an online program that's done in a small group, and it has tons of community support, education, and live coaching involved. So it is a very different model than traditional one-on-one, seeing one doctor here, one doctor there, which is what we've all done, which is why so many of us all are still sick. So I have quite reasons why that's the case. But what I have discovered is that the online format, an educational format, and a true expert in autoimmunity teaching you how to be the pilot rather than the passenger in your own health has been the most powerful way to actually get results. And in a very short time, it's 2 months. Our program's 2 months. These, we have hundreds of interviews on our YouTube channel and our Facebook group. And these are real people with real results and real outcomes. So don't take anybody's word that these are the results that they have. We have actually the videos with real live people, every diagnosis or no diagnosis at all, turning things around. So I like providing proof. I'm a scientist, I'm a skeptic, and I love providing proof.
Okay. And so you mentioned it being a group program. Why exactly is it a group program?
Yeah. So it goes back actually to, I think we should roll back to why this program was even formed in the first place.
Let's roll back.
Because that was surprising to me. The fact that shit works better in a group was shocking to me. So I can tell you a little bit of the origin around, I was, just so you guys know, first 10 years of my career as a family medicine doctor, a good one. And I got sick and got sicker and sicker and sicker after the birth of each of my children, to the point where by the time I was 36, I went into early menopause, and my doctor friends told me what I told my patients. Oh, you're just getting older, Maggie. There you go. Take some Prozac, get some therapy, get the birth control pill. You're a good little lady. Yeah. 20 pounds later, tons of hair loss later, depression, anxiety, ADD diagnosis later, and fibromyalgia, chronic pain later, I discovered that I actually was really sick with autoimmunity, not just early menopause. Early menopause was triggered by autoimmunity, and I actually had an autoimmune disease. There are deeper answers. There are deeper connections. There was a huge hormonal component to my disease that I discovered that really helped me over the next 18 months turn it around. Like after I discovered autoimmune disease, it took me about 18 months to really learn more and more and more, and then to actually put it together and practice what is actually now the Transform Protocol. And within 18 months of my diagnosis, I was able to, believe it or not, turn around my menopause. My periods came back. My hormones came back to normal levels because the autoimmune attack wasn't attacking my ovaries like crazy anymore. And I reversed all my symptoms in that 18-month time frame. And that was the basis of Transform Autoimmune. But what I ended up doing after that time was opening up a functional medicine clinic in Portland, Oregon, and where half the providers were conventional doctors and primary care providers like me, and half of the providers were naturopathic physicians. And we delivered care around hormonal health, gut health, and autoimmunity. And we amassed the biggest population of autoimmune disease patients probably in the state, It was just, even though we didn't advertise it as that, the fact that got around that being a hormone expert, that's where I started, a bioidentical hormone expert. And then I started to focus on autoimmunity. It just naturally attracted a ton of people with autoimmunity. And that, fast forward, I was getting very frustrated because what it took to take care of the complexity of autoimmunity was very challenging in a clinical setting. People needed a lot of facets of care done in a synchronous time frame. It sounds weird, but by focusing just on one thing at one time, this is why people stayed sick. And so in a clinic setting where I'm seeing somebody and I don't see them for 6 weeks later, and then 6 weeks later, it would take me probably 5 to 6 years to do all the work with that client as we do now in a 2 month time frame. What I discovered was I started an online platform starting to record videos of things that I was saying to clients over and over again. And I recognized that what if I just put us all online in a program? And then why not have a bunch of people do it at the same time with me live coaching them as they absorb and learn some of this content? So, to my surprise, we started our program, I think December of 2017. And by June of 2018, we had over 100 people who've gone through our program. And the surprise shocking is this.
Wow.
Do you guys think in an online program platform, working in a group with other people with live coaching and support, do you think the results were less or slower? Because that was the biggest surprise to me. The results were way bigger, way faster, and permanent. And they continue to get better and better even after they were done with the program. So that shocked me, and I had to figure out why. And a couple of the things that the biggest thing, and I would ask clients this towards the end of the program, was what do you think was the biggest lever that contributed to your success? Number one, they said actually the community. Going through the program with other people created a support structure or network or experience they never had dealing with autoimmunity.
Hmm.
I'm going to ask you guys out there right now, and I'm just sharing my own experience here because I felt like going with an unknown diagnosis for a long time and feeling cray cray. And then even once I finally had the diagnosis, I felt like I was the only person having this experience. When in fact, now I know there were millions of Maggies. Now I know there's millions of Maggies, but just that fact alone and having not having that experience when I was used to one-on-one medicine, being able to experience just a group dynamic of people recognizing, I don't even care if you have Crohn's and I have Hashimoto's. There's so many shared experiences, questions, and answers that I benefited from going through a program with you because I learned so many solutions and you asked questions I never would have thought of. So it made learning 10 times faster.
Hmm.
10 times faster when there are other people going through with different symptoms or different diagnosis or even the same symptoms or the same diagnosis. It doesn't matter. It made the learning 10 times faster.
Wow.
So this is why it's an online program because it works so much better. I closed my clinic 6 months later.
That's crazy.
I had never experienced the rate with which people got better. I also never experienced the ability to provide such a community and personal growth in a clinic setting that was one-on-one as I could in a small group setting in an online program.
Hmm. So I'm just out of curiosity. I mean, you answered a few of my questions there, but out of curiosity, how important it was you to kind of move over into the functional medicine realm rather than sticking strictly in that MD world?
It saved my life. I mean, it was out of necessity. When people are like, why did you go? What is functional medicine? How did you move into it? When this happened to me with early menopause, when I was going through my early symptoms postpartum with both my children, there's no such thing as functional medicine. I mean, that's when I went through med school, UCLA, one of the best schools in the country. And, there were no natural answers, and unless you went to a naturopath. So MDs who got sick, where the meds don't work, which was the only solution I had for people, we were considered like cray cray and we're out on our own, just like people were at that time. I had to seek out a ton of education through naturopathic seminars that were training naturopathic physicians to learn about it. So for me, it literally was just to save my own life. I mean, who the heck wants to have early menopause at the age of 36? Pain of 10 out of 10, weight gain of like 20 pounds, depression, ADD, brain fog, you know? I mean, nobody wants that. I felt like I was literally at my health bottom. And either I was going to die or I was going to I'm smart. I went through med school. Either I was going to die or I was going to save my own life. Why am I not investing in learning about how to save my own life and what other tools are out there? Birth control pills and Prozac did not work, and they made me sicker, fatter, meaner, and I felt like I was going to die. So I had to have other solutions, and that's why I went into functional medicine. And thankfully, it's become a specialty in itself called functional medicine now, where more and more MDs and other practitioners are learning natural ways to use naturopathic and alternative medicine to combine it for me with all my MD training and practice together into something even more powerful. I'll be honest with you, I had no idea how it would turn out with the first 3 months of people that went through our program, I had hoped that they would get similar results in the clinic, but maybe I just didn't have to repeat the same thing to 10 different people in 10 different rooms every day. Maybe it was just more convenient for me at first, maybe I thought. But I was actually completely floored at the level of response we had. One of our first clients, Christina Chun, I remember, she had started out when we were just offering some of the tests online, but she switched and joined our program just about a month or two later when we actually went with our online program. And it was so fascinating to me that I felt so limited seeing her as a client in the clinic. And then when she was part of the online program, I mean, some of you guys, if you haven't seen
Oh.
Christina Chun's video, I did a video 2 months right after she finished the program and a year and a half later. Her results are freaking stunning. And it wasn't even the best result. It was a typical result. We're talking someone with scleroderma, lupus, Sjogren's, gastroparesis, you name it, migraines, Christina had it. She was just one of the many people that went through the program the first 3 months. I was shocked at how big the results were. Honestly, number one. Number two was how quickly it came. Like, who would say, like, in 2 months, you could turn around a lifetime of pain or 10 years of pain? Did not expect that. It shocked me, floored me, and it really humbled me to really think about there's a lot of legs here, and there's absolutely a different way and a better way to deal with complex chronic diseases like autoimmune disease. The results was what like shocked me and proved to me that this really worked. And over the last 4 years, I've been just making it better and better and better and better. How can we do this even faster? How can we do it deeper? How can we do it even better? And that's an obsessive focus for me is how can I deliver these results for people even better? That's probably my obsessive focus every single day that I think about. But it is shocking. It shocked the hell out of me. Did not expect it.
How long is your program? And then what is the success rate in the program? And the doctor's favorite question, is there a guarantee?
We talked to hundreds of you, and these are the exact same questions that people ask. So, a couple things, which is that what is our success rate? It's huge, and the answer, the thing is that it's bigger than anything I've ever experienced, like for me prior to this, and it's bigger than anyone else have ever experienced who've been through our program. I would say that it's so interesting because I like to show people what the results are. So every week, I actually interview 1 to 2 of our alumni that are graduating from the program. So I'm actually constantly putting out real live interviews of real journeys of people just at the end of 2 months. 2 months is the length of the program working with us, but I tell people it's 2 months to launch you into a year of autoimmune turnaround. It's also providing also in a lot of ways various levels of support. And even once you graduate, you are in part of our alumni group, and our alumni are really tight knit and continue to support your journey in health through life, even after you're done with our program. We have an amazing alumni community. I would invite all of you is that don't believe if someone tell you what their success rate is or something, because I want you to actually see real people and real results and real outcomes. How many doctors, how many programs have hundreds of videos of real people with impossible to solve medical problems and complex problems go through this? You can even search, go on our YouTube channel, go on our Facebook group. You can search, look at the guide section in our Facebook group, or just comment in the comment section below right now what your diagnosis or condition is. And a member of our team will ask a couple questions, and we'll even send you those video resources of any diagnosis, any symptom. I've seen it, all of it, done it all. Okay. Is there a guarantee? This is really an important thing. It is illegal in the United States to make any guarantees on a healthcare product or service. Illegal. So if someone tells you that they're guaranteeing you the results, whether they're selling you a supplement or a service, they are violating the law, and it's completely illegal to do so, because how can you make a guarantee about a particular result? Here's the other interesting thing is that when people ask me what is a guarantee, I do actually have one guarantee. Absolutely have one guarantee. If you don't do anything to interrupt the pattern of the autoimmunity that's been happening for the last 10 years, the next 3 to 10 years, that pattern, if you don't intervene in that pattern, I guarantee you will have 100% continued progression the next 3 or 10 years, just like you did behind you. That's guaranteed. And so for me, it's like there's a guaranteed outcome based on your history that's ahead of you if you don't interrupt that pattern. That's for sure. I know that. And for me, like if you think, oh, can this help my lupus? Can it help my Sjogren's? Can it help my RA? Absolutely.
How permanent, for lack of a better term, are the results from the program?
I think it's more of a question about sustainability. A lot of people are like, you have a lot of interviews and they look really great and they're just 2 months after the program, right? To me, it's like, it is just 2 months after the program that they have these stunning results, right? And I love the fact that we have a ton of interviews 1 year, 1.5 years, even 2 years later. We have many interviews of people because I love that sustainability question. Here are the results. They're even better. Because this is, for me, at the core, I'm actually educating people how to actually be the pilot and no longer the passenger in their health, and how to advocate themselves with their doctors for the rest of their lives. So how could that be just a 2-month outcome? That's a permanent long-term outcome, not only for that person, but for generations, for people above the generation above them, for the generation below them. This is altering 3 generations of healthcare journey outcomes, period.